Welcome to the last session of the teleconference. In our previous two sessions, we have discussed about assessment, and now we will be discussing about the identified treatment and treatment of the young infant. Before that, I want to inform all of the students now that our next teleconference will be on the last Sunday of month of May. You please confirm the timing before with the regional center, or you can contact the program coordinator so that you can get the right information. The second thing is regarding the material. I had already announced in the morning, and again I want to tell now that the materials, first a lot of material is dispatched. You will receive it within a fortnight or so, but our second spell will be only from the month of July. So please note, we will start the second spell after you receive the material so that you can work up the logbooks and other things as per the prescribed guidelines. I want to also inform you that you can contact the regional center if you have not received your identity card till now. Some of the students are complaining that they have not received any information. Please contact your program in charge or your regional center so that you will get the relevant information. Now coming to the session today, I will now request Dr. Nangia to tell us about the last component, that is assessment of the breastfeeding and malnutrition. Dr. Nangia, please.
Okay, now we are going to, after having assessed for possible serious bacterial infection and for diarrhea, we are now going to assess for feeding problem and for malnutrition. And I'll just remind you here that assessing for possible serious bacterial infection, every infant had to be assessed. Similarly, for feeding and malnutrition, you have to assess every infant irrespective of what the complaints the mother has brought the child with. It's important to assess feeding because feeding or growth in the initial 2 years has a bearing on the lifelong of the child. Similarly, you have to assess for malnutrition based on recording of the weight, which we did right in the beginning. So these are the two tasks that we are going to accomplish here. For checking for feeding problems, you have an elaborate set of questions which go into the details of how the child is being fed. So we'll look at them and then we move on to looking at the video. So just be with me at the chart. You're going to, the process is similar. First ask, then look, listen and feel. So again here there is no listening, it's only looking and feeling. You're going to ask, is there any difficulty in feeding? Is the infant breastfed? Because we expect that the infant should be breastfed at least 8 times in 24 hours or more. So the infant should be breastfed both day and night. So that's the second question to be asked. Third, is he receiving anything else apart from breastfeeding? If that is being received, we have to accordingly counsel the mother to reduce that and stop that. And finally, what do you use to feed the infant? I must remind you that while we are assessing, we are not counseling or treating. We are only doing the assessment. We are marking out whatever are the problems that are found, and then we determine the weight for age, and then we decide in this particular child do we need to assess the breastfeeding, which has to be done for a period of 4 minutes. So what are the situations where you have to assess breastfeeding? If there is any difficulty in feeding complained by the mother, which could be that the child feeds too fast, he feeds very slowly, he doesn't take to the breast. So yeah, any of these things.
There is a call from Jammu. Yes, Jammu. Yes. Yes, I think it got disconnected. Okay, fine.
Okay, so we are continuing with the assessment. So if the infant has any difficulty in feeding, or is breastfeeding less than 8 times in 24 hours, or the mother is giving any other food or drink, or you find that on assessment of the weight, the baby is low weight for age. So if there is any of these conditions being fulfilled, you need to assess breastfeeding. But remember, if any child falls in any of the pink classifications and needs to be referred urgently, then we are not wasting time in assessing breastfeeding here, we are going to refer the child. So this has to be remembered as to which are the situations where we have to assess breastfeeding and which is the situation where even though there is need for assessment, we will not assess because the child has to be referred. Now what we are going to do is, we are going to see a video. You will view a video on breastfeeding attachment and breastfeeding positioning. And if there are any problems found in that, we are going to also learn how to correct that positioning and attachment problems. So let's see the video on breastfeeding attachment.
The young infant for feeding problem and malnutrition, including how to assess a breastfeed.
First, ask the mother,
Is there any difficulty feeding?
ask,
Is the infant breastfed?
if the mother answers yes, ask,
How many times in 24 hours?
next ask,
Does the infant usually receive any other foods or drinks?
if the mother answers yes, ask,
How often?
then ask,
What do you use to feed the infant? Look for visible severe wasting.
look for severe wasting of the muscles of the shoulders, arms, buttocks and legs. The hips look small compared to the chest and abdomen. Look at the child from the side to see if the fat of the buttocks is missing. Determine the young infant's weight for age. You need to assess breastfeeding if the young infant has any difficulty feeding, is breastfeeding less than 8 times in 24 hours, is taking any other foods or drinks, or is low weight for age, and has no indications to refer urgently to hospital. Assess breastfeeding in the following way.
Ask, do you have pain while breastfeeding? If the mother says yes, look for sore nipples and breast engorgement or breast abscess.
Ask,
Has the infant breastfed in the previous hour?
if the young infant has been fed and is not interested in feeding, ask the mother to wait and tell you when the young infant is ready to feed again. If the infant has not fed in the previous hour, ask her to put him to the breast. Observe the breastfeed for 4 minutes. Is the infant able to attach? Look for the 4 signs of good attachment. Good attachment is essential for the young infant to feed well.
The 4 signs of good attachment are the chin touching the breast, the mouth wide open, the lower lip turned outward, more areola visible above than below the mouth, this young infant is well attached with the chin touching the mother's breast. This young infant is attempting to feed with its chin not touching the breast. There is an obvious gap between the young infant's chin and the mother's breast. This child is not well attached. When the young infant is well attached, the mouth is wide open. This young infant is feeding with its mouth wide open. This young infant is feeding with its mouth partially closed. It is not well attached to the mother's breast and is therefore having difficulty feeding. When the young infant is well attached, the lower lip is turned outward. With this young infant, you can clearly see the lower lip turned outward while he is feeding. With this young infant, the lower lip is turned inwards. It is not well attached. When the young infant is well attached, more areola is visible above than below the young infant's mouth. With this young infant, you can clearly see more areola above than below the mouth. If there is the same amount of areola above and below the young infant's mouth, as in this child, or if there is more areola visible below than above the child's mouth, the young infant is not well attached. When a young infant is well attached, as in this case, he shows all 4 signs of good attachment.
Then look to see, is the infant suckling effectively?
When a young infant is suckling effectively, he takes slow, deep sucks. Sometimes he pauses and then starts suckling again. You may be able to see him swallow. This young infant is suckling effectively. This young infant is not suckling effectively. The young infant is making mostly rapid sucks. You cannot see swallowing. A young infant who has had a good breastfeed will stop suckling and release the breast spontaneously. He has had enough and is satisfied. He has lost interest in the breast and he appears relaxed and sleepy. This young infant demonstrates the signs of good attachment. The chin is touching the breast. The mouth is wide open. More areola is showing above than below the young infant's mouth. However, you cannot see the lower lip. This is because she is very close to the breast, making it very difficult to see her mouth at all. This sometimes happens with babies who are very close to the breast. We asked the mother to hold back her breast so that we could see what was happening with the lower lip. You can see that the lip is turned outwards. If a baby is very close to the breast and shows the other signs of good attachment, the young infant is probably well attached. You do not need to hold back the mother's breast to check the lip. You can see that this young infant is giving slow, deep sucks, sometimes pausing and swallowing. The young infant is suckling effectively.
Look for ulcers or white patches in the mouth. Ulcers or thrush can make it difficult for the infant to suckle.
If an infant does not suckle effectively, the breast milk does not flow well, and the infant gets it slowly. He may want to suckle very often, or for a long time, or he may gain weight too slowly. If an infant is poorly attached or not suckling effectively, you should help his mother to position and attach him better.
To attach well and to breastfeed effectively. In a well-positioned child, the neck is straight or bent slightly back. The infant's body is turned towards the mother. The infant's body is close to the mother. The infant's whole body is supported. This infant is well positioned. His neck is straight. He is turned towards his mother. His body is close to his mother's. and his whole body is supported. The following are signs that an infant is poorly positioned and that it may be difficult for him to attach well and breastfeed effectively. If the infant's neck is twisted or bent forward. If the infant's body is turned away from his mother. If the infant's body is not close to his mother. If only the infant's head and neck are supported. If any of these signs are present, the infant's position may need to be improved. This infant is poorly positioned. His neck is twisted. The child is on his back, with his body turned away from his mother. The infant's body is not close to the mother. She is not supporting his whole body. This infant is poorly positioned. The infant's body is not close to his mother and is not well supported. You will now learn the steps to help a mother to position and attach her baby correctly. First, make sure that the mother is in a comfortable position and that she's relaxed. If she's sitting, she should be on a low seat and her back should be straight. If she's lying down, she should be on her side in a position in which she could sleep comfortably. She should hold her infant with his head and body straight and facing her breast. With his nose opposite her nipple. She should hold the infant close to her body, and she should support his whole body, not just his head and neck. When the young infant is in a good position, show the mother how to help him attach to the breast. She should touch her infant's lips with her nipple. Wait until the infant's mouth is opening wide, then move her infant quickly onto her breast, aiming the infant's lower lip well below her nipple. Let's watch that again. The mother touches her infant's lips with her nipple, waits until the infant's mouth is opening wide, then moves her infant quickly onto her breast, aiming the infant's lower lip well below her nipple. Look for signs of good attachment and effective suckling. You can see that this infant is well attached and suckling effectively. If the attachment or suckling is not good, take the baby off the breast and try again. It may be necessary to try several times, and for the mother to practice at several feeds to get her baby to attach well every time. Explain to the mother what to do, so that she can practice attaching the baby correctly when she's at home. Explain to the mother that if her baby is well attached, she should let him feed as often as he wants. Breastfeeding 8 or more times a day helps to ensure a good supply of milk. Explain that at each feed, she should let her baby breastfeed for as long as he wants. She should not stop the breastfeed.
So you found how to position the baby when there is a difficulty in breastfeeding, and we also showed you how to assess breastfeeding also. Now we request Dr. Kusum Nangia to tell us how to classify the malnutrition and how to help the mother in positioning. In those practical tips maybe she can give us. Dr. Nangia, please.
Okay. We were assessing the young infant for feeding problem and malnutrition. You have already seen the video on how to assess for feeding problem. Let us now look at how do we assess for malnutrition after having taken the child's weight. So you will see that we have this. This is a grid which is shown. This is a small excerpt from the WHO growth chart, which is showing you the infant's weight, infant's age in weeks on the x-axis. So you have infant's age which is given in weeks over here, and infant's weight is given in kilograms, and you have the breakups in between. And what you can see is two lines which are running upwards. The lower line is the line called very low weight for age, and the line which is just above this is the line which is called low weight for age line. Please do not confuse these terms with low birth weight or very low birth weight. This is very low weight for age and this is low weight for age. So if the child's weight and his whatever is his age is, we plot this on this graph and we see whether the child is very low weight for age or low weight for age. So we've taken this one example which is showing you a dot here. This is a 6 weeks old child and he is weighing 3 kilos. So this is the point which is marked. I hope that is clear. So 6 weeks old child, 3 kilo, and this child is above the very low weight for age line. However, he is below the line which is low weight for age. So this child will be classified as a child who is low weight for age because this point is lying below the low weight for age line. However, if any child's weight is below the very low weight for age line, if the same 6 weeks old child was weighing something like 2.4 or 2.6 kilos, he would have been below the very low weight for age line and we would have classified him as a child who is very low weight for age. So any child whose weight lies on the line or above the line is a child who is not very low weight. If it is lying below the very low weight for age line, this child is to be labeled as very low weight for age. Now let's see how do we go about classifying feeding and malnutrition. We will go back to the chart and here you again see the color coded scheme and there are 3 classifications which are given. So if the child is not able to feed at all, or if there is no attachment to the breast, or the child is not sucking at all, or he is very low weight for age as we saw on the graph here. So then this child will be classified as a child who is not able to feed, possible serious bacterial infection or severe malnutrition. And when we say not able to feed, this means that the mother is trying hard but the child does not feed at all, does not attach to the breast at all, or even if she is attaching the baby to the breast, he is making no suckling efforts at all. So only then this sign is positive when we say not able to feed or no attachment at all or not sucking at all. So if any of these is present or he is very low weight for age as per the growth chart, we are going to classify him in this pink classification and the child is to be referred urgently. However, if there are other things like he is not well attached, though he is attached, you saw the 4 signs for attachment. Out of these 4 signs, all 4 were not being fulfilled. Maybe 2 or 3 were being fulfilled. So then we call this as not well attached to the breast. Or a child who is not sucking effectively. He is sucking very fast. He is not pausing in between. So if there are any of these things, or a child who is feeding less than 8 times in 24 hours. So if you have any of these problems, these are to be classified as feeding problem or low weight for age. So if you find low weight for age on the chart, this also comes in here. So this is a child who requires treatment in the clinic and requires counseling for correcting the attachment or correcting the baby's suckling efforts. If any of these, none of these are found, then this child is neither low weight for age or has any sign of inadequate feeding. So this is a child who actually has no feeding problem. He has to be only advised, his mother is to be advised how to take care of this child at home. So these are the 3 classifications based on all the assessment that we have done in breastfeeding and based on the weight of the child. Okay, lastly, before we finish the complete assessment, and let me remind you here, if you find a child who has any of the pink classifications, he may be fitting in here for severe jaundice or he may be fitting in here for severe dehydration, you still need to assess the child completely and only then refer him. Referral will be talked about in detail a little while from now. So the last thing in assessment is assessing the immunization status of the child. As we had given you the example earlier, this child has received OPV and BCG at birth, so we are going to tick BCG and OPV 0 dose. And if this child is 6 weeks of age today, we are going to encircle DPT 1, OPV 1 and hepatitis B1, because these are the vaccinations that he requires today. So this is how we are going to assess for child's immunization status. Whatever he has received is to be ticked, whatever is to be given today is to be encircled, and subsequently when does he have to come, we are going to mark that on the chart. So that completes the assessment of the sick young infant for possible infection, for diarrhea, for feeding and malnutrition, and lastly assessing his immunization. And there is a very little small last column which says that if there are any other problems, you need to assess for other problems. The mother may give you problems which are not covered in this purview. So these may be surgical conditions, an extra finger, an umbilical hernia, and so on and so forth. So you need to assess for them. If it is beyond your purview for management, you are going to refer this child. Again, this is not an urgent referral, but this child will need to be referred.
Thank you, Dr. Nangia, for explaining how to classify the malnutrition and how to also go for the breastfeeding component. Now I will request Dr. Chalani to tell us that after we assess and classify, then we have to identify the treatment. So how we identify treatment from the chart book, and maybe you can also tell us some key points regarding the treatment itself, including the recording form, so that the students can be, including the referral slip. Yeah, Dr. Chalani, please.
Thank you, Dr. Jana. Having assessed the child for possible bacterial infection, diarrhea, and checking the child's feeding problem, and not forgetting the last column which Dr. Sushma said about the immunization and any other problem, our next step, if you see in the chart booklet, is the identify treatment column. Now, we have to understand what is the difference between identify treatment and treat the child. Now, just giving an example, that for example, if you have come to if the child who has come to you with enteric fever, now, and you have decided that he has got a shock also, then so what you are identifying this treatment is that I am giving the treatment of the chloramphenicol or ceftriaxone. That is the drug which I have selected. Then I am managing the shock, and also this child is hypothermic, so I am raising the temperature also. So these are principles when you are saying that decides the identified treatment. Now, when actually you give the fluid or actually you give the medicine, how much the dose is to be given, that constitutes the treat the child. Now, in the column, if you see the identified treatment, now there are red boxes and there are the yellow boxes and the green boxes. Now, red means, as we said, the baby is to be referred. So whenever you have assessed the child, you first decide whether the baby requires an urgent referral to hospital or not. If a baby requires urgent referral to the hospital, the principles of the identifying treatment is you have to refer this case urgently, and you have to explain to the family the need for the referral. Along with that, you have to provide a pre-referral treatment, and lastly, providing the referral slip, so that with this referral slip, when it is taken to the other hospital, which mentions all the medications which have been given and how we have assessed the child till now. That we will learn now from. Let's go first. Now let's take the example of a baby who has got a possible bacterial infection. Can we just focus on that? Now this child, the treatment which has been written, that give first dose of intramuscular ampicillin or gentamicin, treat to prevent low blood sugar, warm the young infant by skin to skin contact, advise mother how to keep the infant warm on the way to the hospital, and refer urgently to the hospital. Now this is whatever is the treatment which has been written, this you will find the detailed steps of this in your chart booklet. For example, the red box treatment is written in these are the treat the young infant and counsel the mother. So all the treatments which are bordered in the red, they are providing the treatment of the red classification. So if we have a yellow classification, let us see the local bacterial infection. You will find the treatment of this as the give oral cotrimoxazole or amoxicillin for 5 days, teach the mother to treat local infection at home, and follow up in 2 days. Now this treatment you will find in the chart booklet if you have a look on the treatment box with the yellow border. Now how to write this treatment, we will see. Now this was the recording form which I showed you, and here this was the box where we made the classification. You fold this like this, and we will see how we are writing the treatment on the back of this. We have taken the two examples. In one, the baby requires an urgent referral to the hospital, and in another where the baby requires the treatment to be provided at home. We will now see how it is to be seen. Let us first come to the local let's see the treatment of the case which has been done for the possible bacterial infection. Now let us first see what this child's assessment was. That this child had fast breathing, was having grunting, and on basis of these signs we made the classification of possible serious bacterial infection. Along with that, the child also had the classification of feeding problem or low weight. Now after this, you fold this and you have identified the treatment. Whatever is the treatment which is of the red box, you write down same as it has come here. Similarly, for the feeding problem, you write down the treatment. Out of that, now you select the treatment which is to be given for the baby. Now for example, this child requires referral to the hospital. It requires injection ampicillin 0.5 ml, that is, if we see the 500 milligram per ml, that means 250 milligram, that is given IM as a pre-referral dose. It has been written the time, that is 10:30 AM. Because this timing is very important. If this you are referring the child to the other hospital, they must know when is the second dose to be given. Then we will write injection gentamicin, again we will be writing the time. Then since to prevent the low blood sugar, now if this baby is accepting orally, you tell the mother to breastfeed the baby. Now if the baby is not accepting the feed, you can give express breast milk through the NG tube. So that is to be given, for example, 10 ml per kg. So this child's weight is 2.4 kg, so it is 25 ml of the express breast milk which is given by the nasogastric tube. Mother is also advised to keep the baby warm on the way to the hospital and cover the baby so that baby does not get hypothermic. Now this treatment which we have written is written on this side. Now let's see how we will put it on the, how will we write down the referral slip. Now on the top we will write down urgent referral to the hospital. We will write down the child's name, the sex of the baby, weight, and the ID number or MRD number or OPD number, whatever it is. Then you write down the classification. Classification of this baby was possible serious bacterial infection, feeding problem. Then this child required immunization. The child's BCG, DPT, OPV, all these immunization. But immunization is not given at the health facility because this child you are referring. So we do not want to waste the time on this, and let this in place where you are referring. Immunization will be decided once the acute problem is taken care of. After that, the treatment which the pre-referral treatment was given, injection ampicillin at this time and with this dose, and this is the express breast milk which was given, and then the baby was advised to keep the warm on the way to the hospital, and then signature of the individual, the name of the individual, and the place from where you are referring. It's also important if you write down your telephone number so that if there is any other information which is required, the place where you are referred, they can ask for the information from that place. Now this was the example of a baby where we have referred the child to the hospital. Now let us go through the how to write down a treatment of a case where we are sending the baby with some antibiotics or with some other advice. Here this child, Harish, who's 4 weeks old, weight of 3 kg, and has come with the umbilical discharge. The mother has found that there is a discharge, and the healthcare provider assessed the pus was coming out from that, and this was the only sign which was present, and therefore it was circled. The classification which was made was the local bacterial infection. When this mother was asked for diarrhea complaint, mother said diarrhea is not there. Then, since the assessing feeding or malnutrition is a compulsory box, we assessed that and we found there was no feeding problem. The baby has already received BCG and OPV, and since this baby is 4 weeks old, the next dose is due at 6 weeks of age. Now let's see how to identify the treatment. Now if you see this child and see the table of the cotrimoxazole, this baby is 3 kg, so this baby will require tablet cotrimoxazole, 1 tablet twice a day for 5 days. Now please remember, if the baby's age is less than 1 month and the baby is having jaundice, instead of cotrimoxazole, you give amoxicillin. Apply the gentian violet paint 0.5% twice daily after cleaning the umbilicus. This you will learn about more how to treat the local infection when you are coming for your spell at the program study center. Then you also advise when to for follow-up. Now this child must be seen after 2 days, whether the umbilical discharge has improved, whether the child has got any other sign of the possible bacterial infection, or whether this baby has improved or not improved, or whether, so this follow-up, definite follow-up in 2 days is very important. So that is to be written here, written for follow-up in 2 days. Now also you explain the mother what are the danger signs on which the baby should return immediately to the hospital, irrespective of the time or the date. Even if the baby has been called after 2 days, but suppose the baby, mother says the baby is not accepting feeds, or the baby develops fast or difficult breathing, then mother can come even earlier. So that is, you explain the signs. This you will learn more when we come and learn during the spell what are the signs on which the mother comes to the hospital in when there is some emergency. And then take this opportunity to talk about the mother's health also. So this is how you write down the treatment of a baby who has got the local bacterial infection, or the baby who requires urgent referral to the hospital.
Thank you, Dr. Chalani, for so lucidly and so briefly discussing about the treatment part, because it is a very huge activity and you will be practicing them more and more during your spell training. So the purpose was here just to tell you the principles and the guidelines. I think we have only 5 minutes left. So quickly I will request Dr. Kusum Nangia to tell us about the kangaroo mother care, which is very important to keep the baby warm. So maybe she can take 3 to 4 minutes just to tell us the procedure, then we will wind up the session. Dr. Nangia, please.
I'm Dr. Sushma Nangia. Give me a second for that. Okay, we will talk about how to keep the young infant warm, and how to provide kangaroo mother care. So in this, the baby is dressed like this with a cap and with a pair of socks, and there is no clothing over the baby's torso. So the baby has a nappy, socks and cap, and the mother is also, the mother, father, grandmother or any other family member can provide kangaroo mother care. It is not definitely that only mother has to provide. If mother is indisposed, any other person can provide the kangaroo mother care. So the baby is placed like this between the mother's breasts or on the father's chest. If I can take the liberty, I'll show you here. So can you please focus here? Okay. So the baby is placed like this and his head is turned to one side so that the baby does not suffocate. So this is how the baby is, and you can just imagine that the baby's ear is at the mother's heart level. So the baby is listening to the mother's heartbeat, and the baby is clinging to the mother on both the sides. Even the feet can be by the side, and the baby and mother both are covered with mother's pallu or dupatta or whatever is the shirt that she is wearing. So the baby is in skin to skin contact with the adult member with whom the baby is to be cared for, and this helps in maintaining the temperature. If the baby's temperature falls, mother acts as a incubator to provide heat to the baby, and similarly if the baby somehow is warmer than the mother, then the mother acts as a heat sink and the baby's temperature is regulated, it remains normal. Not just the temperature, even the baby's hemodynamics, the heart rate, respiration, all these things are regulated, and such babies grow more, they get better weight gain. Also, these babies do not contract infection. So the mother is advised that for small young babies, especially who are below 2.5 kilograms, this is one modality which should be practiced for as long as they can, and definitely during the transport for a sick child.
Thank you, Dr. Nangia, for so briefly and keeping to the time. Please note, this kangaroo mother care can be done, as already pointed out, not only it is for mother, because it is told kangaroo mother care, but any adult member in the family can use this, and especially during transport and in the winter seasons, it is very important to provide this care. Now I thank both the experts, Dr. Chelani and Dr. Kusum Nangia, being here and explaining the IMNCI, especially young infants, so lucidly. And I thank all the viewers, including the students, the people at the regional centers, for participating in this teleconference session for the PGDMC program. Please note, our next teleconference will be on the 4th Sunday of the month of May, and I request all the students, please contact your regional center or the program in charge for confirming the date and time of the next teleconference. I also expect that you will receive the material within 2 weeks, because it is already dispatched yesterday, and our next spell, that means the second spell, will start only from July. I want to convey the students who have not attended the first spell, please contact the program in charge or the program coordinator at Delhi, so that you can attend the alternate spell, because without attending the first spell, you cannot attend the second spell. So the students who have not attended this first spell, please contact the program in charge or the program coordinator, so that it can be planned before the second spell starts in July. I again thank the experts and the viewers for being with us with the teleconference. Thank you all.
Thank you.